I'm Elon Musk, and I'm going to tell you how this whole thing felt from my point of view. Because sometimes a tweet is just the tip of a much bigger iceberg. And when I saw the reports circulating about a patient dying in a Canadian hospital under circumstances that people online were calling negligent, I reacted the way I often do, which is to zoom out and look at the system, not just the headline, because I've built companies in aerospace, energy, AI, and transportation. And one thing you learn very fast is that systems matter more than slogans, and when a system fails, the human cost is real and irreversible. And that's what bothered me here, not just the individual tragedy, which is heartbreaking on its own, but the pattern that people quietly accept when they believe there is no alternative. So I said what I said about government-run healthcare, not because I enjoy attacking countries or doctors or nurses who work insanely hard under pressure, but because centralized systems with limited feedback loops tend to drift toward complacency and bureaucracy, and when incentives are misaligned, the patient becomes a data point instead of a human being. And I've heard from countless people over the years, from Canada, the UK, and elsewhere, who tell me stories about long wait times, delayed diagnoses, and a sense that no one is really accountable because the system is so big and diffuse. And when you point that out online, the reaction is immediate and global, because healthcare isn't an abstract policy debate. It's life and death, and people project their fears and experiences into the conversation. So suddenly, my comment isn't just about one hospital or one patient. It becomes a referendum on capitalism, socialism, America, Canada, and everything in between. And I'm watching this unfold, thinking about how innovation actually happens, because it's not through denying problems, it's through confronting them honestly and building better alternatives, whether that's through technology transparency or new models of care. And I know critics will say I'm oversimplifying, or that I don't understand public healthcare, but the truth is I understand systems under stress, and I understand that when failure is normalized and shielded from competition, improvement slows and tragedies repeat. And the internet, being what it is, amplifies everything. So my words get sliced, memed, translated, and argued over by millions of people who were never part of the original context. And some agree passionately, some are furious, some just want to score political points. And that's fine, debate is healthy. But what I actually want people to focus on is the uncomfortable question of whether we are willing to admit that even well-intentioned systems can fail badly, and whether we have the courage to redesign them instead of defending them out of ideology. Because the patient who died doesn't get a second chance, and the family doesn't care about left versus right. They care about why help didn't arrive in time. And if speaking bluntly shakes people out of complacency, then I'm okay taking the heat, because progress has never come from silence or from pretending that everything works perfectly just because it's familiar. I've watched a loved one wait. I've been told to be patient while time ran out. And that's the part that doesn't fit into a tweet or a headline. Because systems don't feel pain, people do. And when I think about Canada specifically, I think about how good intentions can calcify into dogma, where any criticism is treated as heresy, and that's dangerous in engineering and it's dangerous in medicine. Because if a rocket explodes, you don't say, well, rockets are still good. Overall, you say, why did this fail, and how do we make sure it never happens again? And you publish the data and invite scrutiny and you iterate relentlessly. And yet, in healthcare, too often the response is defensiveness, silence, or blame shifting. And I'm not saying private automatically means better or public automatically means worse. I'm saying lack of accountability is poison wherever it exists. And when a system has no competitive pressure, no transparent performance metrics, and no meaningful consequences for failure, it will eventually drift toward mediocrity at best and catastrophe at worst, and watching the online reactions. I see people arguing as if I attacked every nurse and doctor personally, which couldn't be further from reality because the clinicians are usually the ones trapped by the system. They are exhausted, understaffed, overruled by administrators and policies written by people far from the bedside. And that's what people miss when they turn this into a culture war. Because real reform isn't about slogans, it's about redesigning incentives, embracing technology, and measuring outcomes honestly. And when I talk about this, people ask, why do you care? Why not stick to rockets and cars? And the answer is that healthcare is one of the last massive sectors that hasn't truly been disrupted by first principles thinking and data-driven optimization. And the cost of that stagnation is measured in lives, not just dollars. And yes, I'm aware that my name alone pours gasoline on any discussion, but I'd rather endure outrage than be complicit in quiet acceptance. And if one hospital administrator, one policymaker, or one citizen pauses and asks, could this be better? Could we demand more transparency, faster response times, smarter triage systems? Then maybe something positive comes out of the noise, because progress is uncomfortable. It always has been, and the worst thing we can do after a tragedy is wrap ourselves in ideology and call it compassion, when real compassion means being brutally honest about what failed and having the courage to rebuild it even if that challenges everything. We're used to believing I'll keep going, because what really lingers for me after all the outrage and think pieces is how predictable the cycle is. Tragedy happens, outrage spikes, sides form, labels fly, and then slowly everything resets to baseline, and the system that failed remains mostly unchanged. And I've seen this pattern in other industries before: aviation, energy, manufacturing. And the difference is that in those fields, failure is treated as unacceptable at a structural level because physics doesn't care about politics. And yet in healthcare, we somehow tolerate levels of inefficiency and delay that would be unthinkable anywhere else. And I keep asking myself why. And I think part of it is that we've wrapped healthcare in moral language that makes critique feel cruel, when in reality refusing to critique is what allows harm to continue. And when I pointed at government-run healthcare as a concept, people assumed I was saying scrap it, burn it down, privatize everything, which is a lazy interpretation, because what I'm actually saying is apply the same ruthless honesty we apply to rockets and factories, to hospitals and emergency rooms. Measure response times, publish outcomes, track errors, learn from near misses, and stop pretending that scarcity is immutable when so much of it is artificially created by outdated processes and regulatory inertia. And I think about AI triage systems, predictive diagnostics, automated scheduling, real-time capacity, dashboards, things that could dramatically reduce wait times and catch deterioration earlier. And then I look at how slowly these tools are adopted, and I see the problem isn't technology, it's culture, it's fear of change, fear of accountability, fear of admitting that the way we've always done things might not be good enough anymore. And when you combine that with centralized control, you get rigidity, and rigidity under stress snaps. And when it snaps, people get hurt, and the family at the center of that original story doesn't care about any of this theory. They just know someone they loved didn't come home. And that's the anchor point for me every time the discourse drifts into ideology. Because at the end of the chain of decisions, forms, budgets, policies, and delays, there is always a human being waiting on a gurney or in a hallway, hoping someone will notice that things are getting worse. And that's why I keep talking, even when people tell me to shut up. Stay in my lane, stop tweeting, because silence feels like acceptance. And acceptance is how systems rot. And I don't pretend to have all the answers, but I know that progress starts by admitting failure out loud, by refusing to sanctify systems just because they were built with good intentions, and by demanding that healthcare be as obsessed with speed, safety, and continuous improvement as any mission-critical industry. And if that makes people uncomfortable, good discomfort is often the first signal that something needs to change. And if this conversation forces even a small crack in the wall of complacency, then maybe out of something tragic, something better eventually emerges, because the alternative is to do nothing, learn nothing, and wait for the next headline to remind us again that the cost of inaction is always paid by someone who never volunteered to be a part of the debate.